Welcome to the Vision Eye Institute clinic in Bondi Junction. Our surgeons have been performing cataract surgery for over 20 years now, and we're amongst the very first in Australia to perform laser cataract surgery. You're watching this video because you've been told that you require cataract surgery. It's important to be fully informed regarding what the surgery entails, including any potential risks and complications.
You've got a cataract in your eyes. Now, you knew that before you came here, and we've confirmed that today. What that means is the natural lens inside your eye, instead of being clear, has become opaque. So it's like looking through frosted glass. Light can't get in cleanly into your eye, so you can't see properly. The way to fix that is to remove that lens from the eye, the cataractus lens, and replace it with an artificial lens that is clear, that will restore your vision. Now, by putting a new lens inside your eye, we have an opportunity to take a lens that matches the focusing requirements of your eye, so that we can get your eye in focus, and you should be able to function for most things without glasses. And if we use a kind of multifocal lens implant, you can function for both distance vision to drive and watch television, and also to read for most situations without having to wear glasses. Now, presbyopia is something that happens to everybody. You're now in the age group where presbyopia exists, so you're unable to see for things up close. So you've got the cataract, your eyes are out of focus, and you have presbyopia. So you've got a few things we need to try and fix if we're going to get you functioning without being dependent upon glasses. To correct for the focusing with your eyes, we choose a lens implant that matches the focusing of your eye. If you have astigmatism, we use a lens that also corrects for astigmatism. And because of presbyopia, we can now choose lenses that are kind of multifocal lenses that allow you to see for close vision as well as distance vision, so that once we're finished, you should be able to see for most situations without having to wear glasses. Now, you may still need some magnifying glasses, some readers for small print or for reading when the light is poor, but for everyday vision, you should be able to go by without glasses. The operation we're talking about to improve your vision is cataract surgery. This means we're going to remove the cataract from inside your eye and replace it with an artificial lens. This is a very common kind of surgery. This is the most commonly performed prosthetic operation around the world, meaning an implant in the body. Very successful. In Australia, each year there are about 250,000 cataract operations with lens implantation, so very common and very successful. The surgery we do is day surgery, so you'll come in, you'll be prepared for surgery, you'll have drops in the eye, it's local anaesthetic with some sedation, so that it's a very comfortable and pain-free procedure. It will take about 15 minutes, so it's not a long operation. You lie down, and we operate using a microscope. Your sensation during surgery is really just some lights moving. You may not off to sleep, you may be half awake, half asleep, but it's a comfortable and pain-free thing to do. Once we're finished, you go to the recovery for half an hour and go home. By the next day, you should be seeing well enough to function. There's no prolonged recovery with cataract surgery because once we're finished, because we're using local anaesthetic, no injections around the eye, your vision recovers very quickly and most people can drive the day after surgery. We want you to come back and see us before you drive. That's the normal outcome with surgery. People often ask if the cataract can grow back. Well, it can't. Once we've removed the cataract, we've taken that piece of the body away completely and replaced it with an artificial lens, which should last forever. The lens should outlive you. It is common though that after the cataract surgery, a layer of scar tissue can grow behind the lens implant, and this used to be called a secondary cataract. That's a simple enough thing now that we treat with a very fast laser intervention if that's required, typically a few months after surgery. That'll happen to at least 20% of patients having cataract surgery. When you have a cataract, instead of the lens being clear, as it's meant to be, it starts to become opaque. It can be white in the center, it can be diffusely white, but the clear layers of the lens become opaque so that you can see that light can't get cleanly into your eye. Now, with surgery, we're going to go into the eye, we're going to remove that lens from the eye, sometimes using a laser, and replace it with an artificial lens that is clear so that light can pass clearly into the eye. The artificial lens looks something like that. Now, that's obviously bigger than it really is, but it's a bit of acrylic material, it's flexible, so it can be folded up and placed through a very small incision. This lens is a kind of multifocal lens that also corrects for astigmatism. The reason you'll choose to do the surgery now is because you want to see better. As we've discussed, you'll have better quality of vision and there's a good chance you'll be able to function without glasses. The reason you choose not to do surgery is because you know it's an operation and complications can occur. So that if we do cataract surgery, for example, there's a risk that you could get an infection inside the eye. And if you've got an infection, that will be sight-threatening and would need urgent intervention to prevent that becoming more of a problem. This is a very uncommon thing to happen, but if it does, it's a bad complication from cataract surgery. We've done a lot of measurements on your eyes today, so we know a lot about them, and that allows us to calculate the strength of the lens that we're going to implant into your eye. And that's quite a predictable thing to do. But we're still relying upon certain assumptions about the human eye, things that we can't measure directly. So just occasionally the lens that we put into your eye, despite all the measurements being perfect, won't be ideal, and we may elect to remove it and replace it with a different kind of lens, or even put a second lens into the eye, or sometimes do a laser correction surgery as well to fine-tune the focusing. To treat your astigmatism, so that you don't have to wear glasses to correct for it after your cataract surgery, we're going to use a toric intraocular lens, which has built into it correction for the astigmatism, which is very clever. But as you know, with your glasses or contact lenses to correct astigmatism, the lens has to be in a certain position on your eye. The same thing applies to my lens implant. So I'm going to put it into your eye and I'm going to align it with the pre-existing astigmatism so that we can neutralize it to allow you to see without glasses. Occasionally that lens can move by itself inside the eye, and we may have to go back into the eye and put the lens into a new position to get better correction for the astigmatism. Not such a common thing. It may occur in about 5% of patients.
The surgeons at Vision Eye Institute Bondi Junction have performed many thousands of cataract procedures. Our goal is the same as yours, to help you achieve clear vision after cataract surgery and reduce or eliminate your dependency on glasses.